Okay. Thank you very much, Kelly. I hope the audio is working. We've got this and we've got this. Can everybody hear okay? Okay. I come from a particular political perspective, which annoys, I know, some of you, but I think it's important to understand that all of us have a different perspective based on who we were and how we grew up. And I remember a friend of mine telling me that his grandfather was going on a timbering expedition, and he jumped off the wagon that he was riding on to get a glass of water, and he got fired. Well, that incident just was built into that fellow's mind, and he developed a very nasty attitude toward employers and was very pro-union, so that's understandable. So I'd just like to share a little bit about where I'm coming from so you can see what's embedded in me. And my grandfather, I remember sitting at a kitchen table when I was about 14 years old, said that he would die before he took welfare. And this was a very strong Germanic kind of a guy who believed in self-responsibility and didn't believe in entitlements, and that in America you could accomplish anything if you just worked hard and made it happen. And so for us as a family to make it financially, my mom and dad took in a roomer. It was Otto Starkey, who worked at the creamery, and that was the way we augmented our income so they could raise my brother and myself. So that has created an attitude of an honor for the private sector system. I interviewed over thousands and thousands of executives that built companies from nothing. One fellow had a car and he sold it and bought a pickup truck. And today you may be seeing C.L. Werner trucks going around I don't know how many, 15,000 trucks that is now because of that humble beginning. So the intensity with which our country has become so divided has to change. A house divided against itself cannot stand. So I just want to ask everybody to realize that while my friend who is the union fellow and I'm a free enterprise guy, we have to work together or this country's going no place. So I'm very grateful to see here in the room people from a vast political spectrum that we can work together in the community. And our goal tonight is to begin a dialogue as to how do we figure out how we can create a healthcare system that's going to work. Because we now have a large belief that the existing system is getting ready to implode. You know, one of the architects, Senator Baucus from Montana, said this is a train wreck ready to happen. Another Democrat, Howard Dean, who is a doctor himself, said this is a pretty significant problem. So rather than talking about all the negatives, and every day we see people attacking the Affordable Care Act, attacking President Obama, that's not going to get us anyplace. If we look why America's great, it's because we thought of positive opportunities. What's next? What's the future? How can we make things better? So tonight, I hope each of you will think of the contributions you'd like to suggest into our dialogue. And maybe as a beginning tonight, we can fashion something that can work for Wyoming and work for our nation. When you think of the intelligence that we have in this community, even in this room, I bet if we sat here for maybe 1 or 2 days, we could come up with a system that would really work. In fact, could I ask now for anybody here who's involved with the medical community or has been with the medical community, if you're a nurse, a doctor on the hospital board, if you could please stand for just a minute and be recognized. So, yeah. It's you we rely on for our health, and we honor you for that, and I think we want to work together so that your lives can be exciting and rewarding going forward rather than having all kinds of regulations and making it very hard for you. So many doctors now, as you know, are no longer taking Medicare patients, and so many hospitals are not accepting certain kinds of insurance. So we've got a real challenge in front of us, and I hope we will take this goal of coming up with some healthcare ideas, and we're certainly not going to conclude anything tonight, but that's our goal, is to just say, how can we make some ideas into the pot that would work? Now, I'd like to show you a couple of slides that kind of indicate the problem, because here's one of Juan Williams, a little video clip, and the point I want to make is the rhetoric that people use to try to deceive people is amazing. So you'll hear him first talk about these poor, unfortunate young people who are out without insurance, and almost in the next breath, he calls them freeloaders. So Matthew, my teammate here, could you run that little video clip?
Sometime next year, in the election year, all these problems return.
Well, I didn't say delay. I said simply,
extend. Okay.
Yeah, extend the enrollment period.
All right, delay the deadline.
But what you're saying is contrary to the fact that a lot of those young people, Britt, don't have insurance.
Yes,
that's
a lot
what's good. So this is much better than not having insurance.
Juan, excuse me. It's much better than not having insurance, according to who? According to Big Brother. Now, for many of these people, young and healthy and very unlikely to need medical care of almost any kind, not having insurance is a perfectly rational choice.
It's not rational. These people are free riders on our insurance system. Every time you go to the hospital, I go to the hospital, we pay higher prices. We pay higher insurance premiums because of these free riders. And those people with no insurance want some confidence that if they get sick, if anything happens, they can go see a doctor.
Well, then if they want it, they ought to be willing to pay for it. If they're not willing to pay for it, it may well be that being free people, they felt free to make that choice.
George,
I think they should.
As I've said to you before, you got to have sharp elbows here.
Well, that kind of spells out the challenge that we have. And I'm not a big Juan Williams fan. And I just feel that we have to be more honest with one another. And the reason that we had so many uninsured people, there was one number was 14 million at one time, a few years back, before the debate kept escalating the number. And of that 14 million, the studies showed that most of those people were 18 to age 32 who opted for a flat screen TV or a ski pass. So I believe that the young people saw that they were being victimized because, we'll discuss later, they were asked to subsidize the older sick people, and therefore their premiums were a lot higher. So if we now show one other video, I think, which shows what was originally intended, and this is no surprise that the thing is unraveling. It was intended to unravel. It was intended to unravel. Now, maybe not the healthcare sign-up site, but the whole scheme was intended to move to a single-payer system by bankrupting the private insurance companies. So if we can run another clip.
I happen to be a proponent of a single-payer universal health care plan. But as all of you know, we may not get there immediately, because first we've got to take back the White House, and we've got to take back the Senate.
So what I've said is, let's set up a system where if you already have health care through your employer and you're happy with it, you don't have to change doctors, you don't have to change plans, nothing changes. If you don't have health care, or you're highly unsatisfied with your health care, then let's give you choices, let's give you an options, including a public plan that you could enroll in and sign up for. That's been my proposal.
A plan that was shopped around to all the Democratic candidates by a Yale University political science professor named Jacob Hacker.
While I think the insurance industry will be very opposed in total, I do think that we shouldn't forget that there's going to be a divide, as there was in the early 90s, between large and small insurers over the best course forward. This would eliminate, I think, the small group market insurance industry, right? It's premised on doing so.
And next to me was a guy from the insurance company who then argued against the public health insurance option, saying it wouldn't let private insurance compete, that a public option will put the private insurance industry out of business and leave my single-payer friends, he was right. The man was right. Here's what
Someone once said to me, this is a Trojan horse for a single payer. And I said, well, it's not a Trojan horse, right? It's just right there. I'm telling you, we're going to get there. Over time, slowly, but we'll move away from reliance on employment-based health insurance, as we should, but we'll do it in a way that we're not going to frighten people into thinking they're going to lose their private insurance. We're going to give them a choice of public and private insurance when they're in the pool, and we're going to let them keep their private employment-based insurance if their employer continues to provide it.
But I don't think we're going to be able to eliminate employer coverage immediately. There's going to be potentially some transition process. I can envision a decade out, or 15 years out, or 20 years out, where we've got a much more portable system.
One of the virtues of it, though, is that you can at least make the claim that there's a competitive system between the public and private sectors.
This is not a principled fight. This is a fight about strategy for getting there, and I believe we will.
Let's have an honest debate. We can agree on that.
So I think you see why someone like myself gets irritated with just the raw deceit that exists in our government today. And it's unfortunately on both sides of the aisle. I can think of a number of things my Republican friends have said that are pretty embarrassing. But the reality is those of us in this room have the power to change things. You cannot believe the influence that each one of you have in your lives. Think of Rosa Parks, that frail little seamstress that got on the bus in Birmingham, Alabama, wasn't it, and said, I'm not going to the back of the bus. Think of all the huge organizations. Was it Susan Komen, started by a woman, said, okay, we'll make this happen. Mothers Against Drunk Driving. Each one of you have the capacity to influence this debate and make things happen, so I hope you'd rise to that challenge. Let's put up a chart, Matthew, to show basically what we're talking about in terms of confusion. There's health, health care, health insurance, and prepaid health care. Now, the health issue can be impacted by our lifestyles. We rate very poorly in some rankings because of our longevity. When we're comparing to Switzerland, maybe it's because we don't have, they don't have a Chicago in their makeup, where last year there's 413 murders. They maybe have a population that isn't so involved in drugs, or maybe they have a more active lifestyle, so that if you look at just the whole idea of health, a lot of our healthcare costs can be addressed by each of us transporting the Jackson lifestyle to other parts of the country, to Wisconsin, for example. If you look at the kind of activities that we have here and how we stay healthy and young, it's because of exercise, because of diet. And Jackson and Wyoming is a classic example of what can happen if we could spread that issue of taking care of our own health, taking responsibility. And secondly, we move to health care. And that's where all of the doctors and people in the hospitals come into play. And I was sitting in a room with 7 sitting governors and 5 presidents of major insurance companies talking about healthcare about 3 years ago. And I won't embarrass by telling you who the president of the one company was, but he said, we have to do something because we're 37th in the world. Do you know where that statistic comes from? The World Health Organization, a division of the United Nations, in 1999 took some statistics, massaged them, and issued them in the year 2000. The reason we're 37th is because they had 5 different categories which they weighted differently. One category was patient outcomes. You know where the United States ranked? Number 1. That's why people from Saudi Arabia and all over the world come to the Mayo Clinic and come to the United States. We're number 1 in healthcare outcomes, patient outcomes. Do you know how much that was weighted? 12.5%. There's another category, fairness of financing, whatever that means, where Morocco and Colombia excelled in being more fair in terms of the financing of healthcare. You know how much that was weighted? 25%. Bottom line is 85.5% of all of the weighting that ranked us 37th from the United Nations had nothing to do with patient outcomes. So if we then move to health insurance, there's a lot of people who have health insurance who don't have health care. In Alaska, it's very hard to find a doctor who will take Medicare patients. And so as we looked as this debate began, yes, there were people without health insurance, and we know a lot of them were here in Jackson. But when they blew out their ACL up on the mountain with no insurance, they had health care. And I think Gary Trauner told me, we've had universal health care, but the problem is it's so expensive because people go to the emergency room, or everybody else has to pay for the people that don't pay, as Juan Williams extolled us. So if we want to basically get to a point where we think about health insurance rather than health care, I don't think that's the right debate. What we want to think about is how do we get people health care, and first of all, encourage them to be healthy because of their lifestyle. So there's a whole bunch of education that can be taking place. Safeway, Steve Bird, has a system where he rewards his employees if they exercise, stop smoking, aren't drinkers, and they have proper body mass weight, so they get a reduction on their insurance premiums if they work for Safeway. That's a way of dealing with the issue of health. And if we also talk about health insurance, I think there's a lot of people that we're going to have health insurance, but as you know, there's a lot of docs that aren't going to be around. It was so sad to see that the bill involved hiring 16,000 IRS agents to make sure all of us pay our fine. And there's a one-page form you can now find that shows how you have to indicate you have insurance so you can avoid the fine. And doctors are really being discouraged. Many of them I've had a number of anecdotal situations where the father tells his son, hey, you signed up for medical school, but why don't you go be a lawyer or investment banker? So we have to protect our healthcare system, our hospitals, our doctors. And if you look at the model that's existed through the United States, we started out, there was provider-driven. Doctors and hospitals sort of were in control of things. And then the insurance companies came in, and they suddenly are the ones who are calling the shots. What I hope we can come up with beginning tonight is a system where it's patient-driven. And we don't have really any great lobbies like the hospitals, the pharmaceutical companies. So we have to unite together in using social media and come up with our ideas that we want and try to pressure the hospitals and the insurance companies and the politicians to help us achieve that basic system. So I want to give you a little example of the challenge of government trying to come up with these solutions. And I love to tell the story about the guy who comes home late at night, he's been drinking too much, comes in the front door, falls down, breaks a glass flask he's got in his back pocket. So he says, gee, I wonder if I cut myself. So he drops his britches and he turns around, looks in the hallway mirror. Sure enough, he's got cuts all over his butt. So he gets some damn Band-Aids. He gets some Band-Aids, sneaks into bed without waking up his wife. Next morning, she said, you were drunk in a skunk last night. Well, why did you say that? Why? Come on, why did you say that? Well, it wasn't because you left the door open. It wasn't because of broken glass at the foot of the steps. It wasn't because of all those drips of blood up my brand new carpeting. It was because of the 8 Band-Aids stuck to the hallway mirror. So what is it that we really want to achieve that a lot of people are talking about? And it's a challenge to get everybody to coalesce around a given plan. Newt Gingrich, as Kelly mentioned, 2 years ago asked Matthew and myself to come with this plan, which we did. Eric Cantor liked it and was going to introduce it in legislative language, and he went to John Kyle in the Senate. There's no appetite for it. And the Republican attitude has been, which drives me crazy, we don't want to come up with an alternative plan because then we won't be able to shoot at Obamacare and let the people know how bad it is, because then the Democrats will shoot at our plan and will dissipate all our energies. Today, that same kind of attitude still exists, but there are now more and more people say, look, behind a no, you got to have a yes. And so the efforts that you all can expend, we can come up with that yes because it exists and it's going to be better for all of us. So Matthew, do you want to flip to the next slide, which I hope talks about what we're kind of looking for? Number one, safety net. Right now, the way we provide for people that have pre-existing conditions and are very, very ill with dialysis and diabetes, how do we deal with that even before Obamacare came along? The head of the Blue Cross Blue Shield organization in Delaware told me it takes 20 healthy 25-year-olds to offset one very, very sick guy. So let me ask you something. Let's show of hands, how many people in this room think it would work if we transfer that concept over to the fire insurance and homeowners? If that's such a good idea, what we ought to do is take one big mansion, $5 million mansion sitting on top of a hill over here, has a huge premium for fire insurance and homeowners. So in order to lower his premium, let's put him in the same pool with 25 people living in double wides in house trailers. Does anybody think that'd be a good idea? That's what we do with healthcare. We take the double wides, the smaller, and they subsidize the big $5 million mansion. That doesn't make sense. But we take the 25 young, healthy people and say, okay, we're going to force you to buy insurance, and because without you, we can't take care of the older, sicker people. So there's a better way of doing that. It's cheaper, and it's much better. And what we do is we create a special pool for those people who have pre-existing conditions and are very ill. So we can move them over here, and they will be able to get additional training. They'll get encouragement. Are you watching your diet? Are you using your insulin? Are you exercising enough? So they can be managed and encouraged to take care of better health decisions when you get up to number one, taking care of their own health. And then, because their premiums will have to be higher, the government, in fact, there's a bill just recently proposed putting $25 billion into a safety net. So the government would then come and subsidize the fact that those people have to pay higher premiums, so they don't have to pay The net effect is they don't have to pay a premium higher than what all the rest of us would have to pay. So that, number one, if we can deal with those people with pre-existing conditions and big expensive health bills through a safety net system, rather than trying to force other people to subsidize them by forcing them to buy insurance, it's a cheaper way and it's a more of an American way where people have choices rather than being dictated as to how they should function. And the second issue is we should have control of our own policies. When you change jobs, you don't change your auto insurance, you don't change your homeowner's insurance. The only reason we change our health insurance is because back in the time of price controls, the government was convinced that employers should have the opportunity to compete for employees by giving them benefits, retirement benefits, healthcare benefits. And so now as a result, we have an opportunity to jump frog way in front of our old system that Obama is abolishing by creating a system where each of us owns our own policy. So it's portable. So the money that the employer can put into our pockets can then be used to buy our own insurance, and that allows us to have that through our entire lifetime. We don't have to worry about changing our health benefits. We have that through our entire life, and we can go wherever we want. You maybe saw Investor Business Daily article just 3 days ago. Under the Affordable Care Act, if you live in New Jersey and you have another home in South Carolina, when you go down to South Carolina, guess what? You're not covered. That was stunning. And we all have read stories about how in New Hampshire, now there's only one hospital that will take this kind of insurance. And I think Cleveland Clinic and Mayo's have said they're not going to be take a lot of the insurance under Obamacare. So here, if we can create where you and I control our own policy, then we can have it portable and we don't have to go through this angst of being stuck in a job we don't like or wondering what's going to happen if we change. So if we look at the third thing, you maybe saw on one of the broadcasts yesterday that President Obama told the Archbishop well before this all started, as a Catholic, your needs will be taken care of, i.e. your conscience, your ideas of what's right and wrong would not be violated. Well, we all now see the lawsuits where the mothers, the Sisters of the Poor, are being faced with huge big fines. The Hobby Lobby people, which have a Christian company that makes crafts and things, they were faced with huge fines because they didn't feel appropriate for them to provide contraceptives to their employees. Now, regardless of how you feel on contraceptives, if you're for them or against them, I mean, Mother Teresa is against them, Rick Santorum's against them, but it's interesting, Rick Santorum, when he's in office, never once said, hey, let's change the laws. He didn't impose his point of view on anybody. But yet here we have a system where people who believe this is wrong are told, yeah, so what? You do what you're told. So I think another policy should honor people's religious freedoms. And doctors who are Catholic, I'm not Catholic, but they should be honored to respect their point of view. And then the choice of doctor and provider. This has been enormously crushed now under the system. We ought to be able to choose any doctor, any provider, go to any hospital we want that will accept us. If we want to go to New York to have our knees done because we think it's a better place to do, we should be able to do that. And our doctor choice is so important. I don't look forward to the fact that if all the doctors suddenly are hired by a hospital, the statistics show their productivity drops like 30%. And that's because it's 5 o'clock, it's his end of his tour, he's going to go to a soccer game. If he has his own practice, he might say, honey, I'm going to be there at halftime, I want to do 2 more procedures. So the doctor productivity is dropping, but also the doctor-patient relationship disappears. So each time we show up, we might be assigned a different doctor. So this is another thing that I believe our policies should guarantee. And then there's the issue of patient privacy. It is unbelievable how much information about us is available through all these networks that exist when we buy a given prescription, and they say, well, your name isn't attached to it. But I believe any policy should have the whole idea of patient privacy. And then here's the biggie. To me, this issue never was about access, because as Gary Trauner said, we have access. Does anybody ever hear of a story of some even illegal immigrant getting run over by a bus in New York City or in Jackson Hole and he lays there and dies? Everybody has access. So the issue that we have to drive is cost. If we can lower cost, it feeds on itself, because then suddenly if the costs go down, then the younger people and more people will be incented to buy insurance. So let's figure out some ways how we can lower cost. You have another slide, I hope, there. Now, we talked about creating special pools for sick people. And here on the freedom to select your own coverage, before Obamacare came along, and maybe it still is included, but in Connecticut, you can get a hair transplant on your insurance. In California, you get a sex change on your insurance. In vitro fertilization, chiropractic, aromatherapy, all these things are included, which all of us pay for. Now, I don't know how many of you are excited about making sure you can have in vitro fertilization. I see some gray hairs out here, but we're paying for that. So the whole idea is we ought to be able to do what the insurance ads say. You've seen the ads. Tell us how much premium you want to pay. We'll tell you what coverage we're going to give. Why shouldn't we be able to do that with health care? Why does the government force us, mainly state governments, to take coverage that we don't really want? So if we can choose our own coverage, we'll reduce the cost dramatically. Think of it this way. What would your car insurance cost if the government mandated you had to cover on your car insurance transmission repairs, tire replacements, gas refills? Does anybody here have any idea what would happen to our insurance premiums for automobiles? But that's what we do with health care. So another option we ought to have is allow people to be able to buy what they want to buy for insurance. Now, transparency of pricing and outcomes. Is it hard, Matthew, to switch back and forth to the next slide and then back to this one? But look what happened in New York City. This is a joke. This is in the Wall Street Journal about, you've maybe seen it. The highest priced colonoscopy they found was $8,500. In Baltimore, the highest colonoscopy they found was $1,900. Now, they tried to find the lowest priced colonoscopy. It happened to be $740, and it was in New York City. So think what would happen if we had transparency of pricing and also transparency of outcomes. Governor Scott, the governor of Florida, he ran Columbia HCA, which I think at that time hired 3% of the American workforce. He said we knew every hospital, how many knees had to be redone, how many infections we had in a knee operation, how many colonoscopies were perforated. That information of outcomes is available. Now it has to be tweaked, because the fear is, well, if someone's concerned his morbidity rates will go up, he's not going to take the very, very severe cardiac heart patients. But we can deal with that tweaking. So if we could you want to go back to the other slide now? If we can get the whole idea of transparency pricing and outcomes, that would allow us to be more sophisticated consumers. Think what would happen if you went into Albertsons. No posted prices. And there's some guy with a little cart there helping you fill up your cart. He gets 5% of everything you put in there as a commission. He's not going to take you to the rice and bean county and to the fruits and vegetables. He could take you to filet mignon and snapper and sea bass. And then we get to the checkout counter. You lay down $100, everything else is covered. Does anybody have any clue what that would do to our price of groceries? Skyrocket. But yet that's what we do with healthcare. It's exactly what we do with healthcare. So they eliminate the free stuff. There's like 10 or 12 things that are now free. One, it happens to be a breast pump, and there's an article about that. So this woman said, I got a perfectly fine breast pump. I paid $200 for it, but now this is for free. So I'm just going to go get a $500 one because it's covered by insurance. So there's a lot of stuff that we might be getting as free, but we have to come to the point of hey, let's pay for what we're accepting and not have all the free stuff, because that's another thing that jacks up the prices very, very dramatically. Now, if we can reward people for being cautious about costs, so they're going to find that $740 colonoscopy rather than an $8,900 one, and they, by being cautious about their consumption of health care, my knee's banged up. Go get an MRI. What's it going to cost? Doctor doesn't even know what it's going to cost. So I tell you what, Doc, I've got this health savings account. Let me ice it and take some Advil for a couple of weeks and get back to you. So it gets better, perhaps. So that would reduce the amount of overconsumption that we as Americans do of health care. And by having a health savings account, which incidentally in Indiana, Mike Pence, the governor there, told me that 80% of the government workers in Indiana have opted for health savings accounts. Because the money goes into the health savings account, you can buy this high deductible, so if you have a real serious illness, you're covered, so you're not going to be wiped out. So therefore, you can take the rest of the money and it accumulates. Right now, a lot of the plans are use it or lose it. Under health savings accounts, it's use it, or under the health savings accounts, it's spend it or keep it. So you can build up huge amounts of value in these health savings accounts over the years if you watch how you take care of your health and you're a careful consumer. So with that, I have to just kind of talk about the lack of bureaucracy that exists here in Wyoming and how we, again, can beacon for the rest of the countries. Because you look at how bureaucratic we've now gone with this Affordable Care Act and how this could be so much more simplified by dealing with the patient and the doctor, the patient and the provider directly, with removing the influence of the third-party payer, be it the government or be it the insurance companies. And I love to tell the story about a lack of bureaucracy when I go out east and talk to my friends there. I said, you know, Wyoming, when a sheriff wants a new deputy, he doesn't go through a lot of rigmarole. Say, hey, give us a resume and fill out this form. Instead, he just asks a few questions, see how savvy this young fellow is. So one of the questions he asked, he said, do you know who murdered Abraham Lincoln? And he goes, gee, I really don't. So he goes back to his wife, says, you get the job, honey? Yeah, I think so. They already have me working on a big murder case. Now we're about ready to get into the question and answers and the inputs from you. I don't know how long I've spoken. This is my first, people tell me I ought to rehearse my speeches, but I don't seem to be able to get around to do that. So I don't have any idea how much time I took, probably too much.